So you could do scooting and get him closer to the edge, right? Here's him. Now what about me? And he's a bigger guy, so what am I going to do? I think I need to be a little bit higher. Okay? I need to be a little bit higher. I'm going to stay out of his way. Okay. Hand placement, options. Manual cues. So I could be higher mid-trunk, right? And here's this position dance space. I could be here, right? Where else could I be? What other options? I could be here and here, right, if I needed to. But I'm going to start with I want you to do this, okay? So sit up nice and tall. As he leans forward, okay, I have to lean back. Why? As he leans forward, I lean back. So, okay, just lean forward. So we maintain the dance space, okay? Go forward again. We maintain the dance space. As he leans forward, I don't do this. Okay? And how does that feel when you lean forward and your therapist is right in your face? Not great, right? So as the patient leans forward, you lean back. And what are you feeling for? You're not trying to lift them. So this is the most critical thing I think we can share with you. When the patient leans forward, what are you feeling for when they're leaning forward? What point? I know we talked about it a little bit.
The weight shift?
We're looking for that pivot point, that weight shift. Because what you're looking for is the point where, sit up tall, he's going to lean forward, and it's just going to be really easy for him to unweighed, with just a little tiny bit of an up and diagonal cue. All right? So for some people, depending on how long their femurs are, their pivot point could be here, right? For some people, it's here. Some people, it's even here. They have really short femurs, right? Okay. If you start with a really flexed pelvis, and you maintain that, where's your pivot point? Way, way, way in front. So it will behoove you and the patient to help them get what? In as neutral trunk alignment as possible. So step one, preset neutral trunk, right? So I'm here, sit up tall. Sit up tall. As he leans forward, what do? I lift you forward. Now right about here, I feel like this could be his pivot point. So what I'm going to do is just with my hands, I'm just going to lean back a little bit and give him a slightly up and forward cue so I get him unweighted. Hold on. Again. And I want you to practice this part. Sit up tall, lean forward, and wait. There you go. And all I did was, I got my dance space, lean forward, pause right here. I am not going to lift him. All I'm going to do is I'm just going to lean back a little bit. Verbal cues are sit up tall, lean forward,
Lift up.
You know, you're going to do this in sequence. You're going to say stand up. So sit tall, lean forward. Okay. You got the unweighting part, which is the key critical part. So you're here, you lean back, and then you take these bottom two fingers and you just give the pelvis a little bit of an up cue. Okay. And that's how you get the patient up. They're already in the squat, right? So what do you got to do? You got to bring them up. You don't want to bring them forward anymore because their weight is already where? On their feet. So they have to elongate. Right? So you just give them a little bit of a cue at the pelvis and up. Okay. And lean forward. Okay, I'm going to pause them right here. This is where I feel the pivot point. So what am I going to do?
Lean back.
Lean back. And then these two fingers up. Back. Back up. And now going back down, I'm going to give him just a straight down cue and then pinky back. If someone's concerned about where the surface is, what you do is just back up. Do you feel the surface against your knees? So then that patient knows, okay, it's right there. Sit to stand, great activity, really helpful in terms of getting symmetrical weight bearing and also getting weight bearing onto an affected side. Great activity for that, right? What if someone has really impaired stance control, i.e. they're not really holding, they're unable to maintain or even get a lot of weight onto their
impaired
How
side.
could you sort of adapt what you're doing to help them get some movement onto that side? So here's the problem. How do you support them without blocking the tibial translation? You want them to come up, you want their tibia to move forward on their ankle, and you want to give them some support. So how do you do that? How do you help them and also not get in their way? Get the base of support, feet, knees, hips, midline. You've worked on all of that. Hands and weight bearing, they can be on the mat, they can be on your shoulders, anywhere you want. You're going to take off your shoes. You can't do this with your shoes on. So you're going to take off your shoe. You're going to put your foot in between their foot. You're going to put the front of your ankle, right, you guys got to see this. Front of your ankle right up against the medial anterior aspect of their ankle, okay? So the side of my toes are on the floor, and I'm just resting my foot. Now, I'm going to take my knee and bring it where? Outside. So it's like my, of course, pumped up gastroc is basically touching Rachel's tibia. So it's soft tissue to her tibia. And the side of my entire foot is down. Now, I'm just going to ask you to do some movement. I'm not going to facilitate your hands. You're so tall. Okay, as she leans forward, right, what I'm going to do is I'm going to maintain contact with her tibia, but as she leans forward, I'm just going to come out a little bit more with my hips. I'm going to go into more abduction because I want to give her some space to do what?
Translate.
To move her tibia forward. So she's here, so as she moves forward, I'm just going to do this. And I'm staying with her. You feel the contact, right? Mm-hmm. As soon as she gets unweighted, that's why that unweighted cue is really clear, I come up a little bit on my heel. So my heel comes up. So now the side of my toe is touching the floor and my heel is up. But what do you feel at your tibia now?
You're pushing it.
You feel more pressure. So what her tibia wants to do what now? Rotate forward, and my tibia my gastroc is stopping her. So I got her. She's not going anywhere. She can't collapse. You could try to collapse now, but you couldn't. Well, your foot would slip, but if your foot didn't slip, you couldn't collapse. And if you feel like someone's foot's going to collapse, sometimes what I also do, I have to take my shoe, you can put your other foot behind. But what you could do is you could, and let's say this wasn't here, you could be like this and like that. And then I really got you. Putting this cue down into the back of your heel. So you're here and here. So as she unweights, I give her space to come up, to translate her tibia. As she starts to build her pelvis up, I come up more on my heel, and I stay with her, okay? So I come into more plantar flexion. And then as she goes down, what would I do? Go into more abduction. Go down, go down, go down. I stay with her, and then she's back down. So I control her going down as well. The key movement is at your heel rising and lowering. Okay, so you start with your foot on the floor, and as she comes forward, I just go into, abduction, and then as she comes up, my heel comes up, and then as she goes down, my heel goes back down. Okay, and you stay with her. Okay, we're going to work on this again. Just come up to standing. This is like a preview. If you have someone in standing, you want them to maintain this. You just keep your hand on the back of their pelvis, and then you could do weight shifts here, right? Get them weight bearing on that side. You could do turning. You can do all sorts of activities to get more weight on that side. And you could even do mini squats. So bend your knees a little bit and up. Bend your knees a little bit and up. And I want you, look up straight. Okay, try to bend your knee. Try to bend your knee. Can you do it? Nope. She can't do it. Why? Because I got her locked in, right? I have opposite and opposing forces. So it allows her to get some weight on that side, lots of proprioceptive input, huge, without, and she doesn't, let's say she's really weak or doesn't have a lot of control. And then you can even get her to a weight shift, bend your knee a little bit. And up. your knee a little bit, so you can get them to start to practice in transition. Bend both knees and go back down. That's it. Good. Okay.